Hi, my name is Fiona Strang and I'm the CEO of HealthWISE. For the past 9 years, HealthWISE primary healthcare nurses have been providing valuable health education and resources in rural and remote towns across our footprint. Our nurses have been frontline workers, in many cases reaching people who don't have ready access to GPs or local health services, and supporting communities devastated in the wake of natural disasters. They have forged many successful and respectful partnerships over the years and built deep trust in their communities. We are sad to say goodbye to this wonderful program, which ended on the 30th of June 2024. But we are so proud of everything the primary healthcare nurses have achieved. Please enjoy this reflection of the Primary Healthcare Nurse Program featuring our nurses and partners, and join us in celebrating the incredible work they have done.
It's been a great journey, a great life journey.
I will remember the long drives to the small little communities where not many people go. We're very privileged to be welcomed into these small communities.
This is the best role I've ever worked in. It's just been amazing. We encompassed, with 4 nurses, what had been done by a larger team, and we got out into those small communities a lot further than I think anyone had been before us.
Apart from being amazing professionals, they're also beautiful women. They go above and beyond.
It's been a fantastic partnership. It's been eventful, it's been fun. If I was going to do it with anybody, it would be Letecia. Experienced lots and lots of things, stayed in some colourful places, ran huge events where we've been exhausted. The travel, the places we've been to, it's certainly been absolutely fantastic. It's just been the best partnership. Letecia's a wonderful work colleague to work with. When we're working side by side, it's beautiful.
I'm very proud of the work we've done in some of the really small communities. In the communities that don't get a lot of access to services, we can go in and do big events, or we can go in and have little cuppers and chats with people. So it's not a traditional nursing role by any means, but it's a pretty special one.
Being primary healthcare nurses, the beauty is, first and foremost, we're nurses. We've had nurses training and we've worked in the hospital systems, we've worked in the health systems. We might have learnt a mental health component. We've covered women's health, men's health, children's health, many diagnoses. So we come with a wealth of knowledge, and we come with knowledge across the board.
When we go to the events, we can offer health checks. We can do blood pressure, pulse, blood sugar, chat to people generally about how they're going.
A health check's a little bit more than putting on a blood pressure cuff. It's about assessing that patient from the moment they turn up. We actually look at their pallor, the way that they've come and they've sat, just their general appearance, going through all the vital signs with them, talking about what medications they're on. We also discuss that it's important to go back and see their doctor. We talk to them about referral pathways and a number of other things.
They tell us what's going on for them at the time, and sometimes we can do those short little interventions, help connect people to services. That's really important. I think the Primary Healthcare Nurse Program is a very unique program. We meet lots of other nurses and partners who are always amazed at the work we do. We're not in traditional nursing roles, but we're bringing the skills that we've learned through our nursing to those little communities.
We are one of the few organisations that go and do the health checks. We're sought after by our partners, and each of them tell us that we provide the inroads for them to get into those communities. They don't have the capacity to get into those communities. They don't know the people like we do. We've been going out there for such a long period of time.
Working with the primary healthcare nurses has been fantastic for us. I work in the space of mental health and rural populations. I've been in the role for about 15 years and I've worked with the primary healthcare nurses, most of that time. They're a great partner to work with. They're so reliable, they're so approachable, they're really familiar with the local communities. So when we work together, it's just a really easy partnership. Rather than turning up to small towns just as one organisation, we can partner with the primary healthcare nurses and go into those communities together. So people aren't coming out for a number of different things, they're coming and accessing several services at once. So for us, it's a really valuable partnership, and we're really disappointed that they're leaving. It's a huge loss. I would say that the primary healthcare nurses provide an invaluable service, particularly to smaller communities. And in particular, the nurses that I've worked with are just so incredibly passionate about their communities and what they do.
The partnership with HealthWISE has just been so valuable to Cancer Council New South Wales. Partnering alongside of another trusted organisation has meant that wherever we've gone with them, we get to access community members that we wouldn't normally have access to. So it's just so important. Having the nurses at events that we go to with HealthWISE just means that people feel safe to approach us. Cancer, of course, is not a nice subject to talk about, but when we're alongside the nurses, they just open up a little bit more easily. And also other smaller communities that we don't even know about sometimes, the tiniest little places. And to have 5 people turn up sometimes in a really small community and be able to pass on information to every one of those people that they go away and then spread is, again, just so valuable to our work, and we know we're supporting each other and trying to improve the health of our communities.
I think that's our strength. That's something HealthWISE does really well, and our program does particularly well. We partner with anyone and everyone, and we go to those little towns together, and each of us can't provide everything to these communities, but together we do some pretty special work. And we really value those partnerships. Everyone has their own skills. A lot of the partners that we have are peak bodies who we know are delivering the right messages to our small communities.
We did a couple of events with Belinda Hook from BreastScreen New South Wales, a major one in Inverell, another one in Tinga, and what we were gearing at across that board was to incorporate our Aboriginal women more. We organised another organisation called Support the Girls. They are professional bra fitters. They actually provided the free bra fittings, and also each of those ladies was provided with, probably 4 or 5 free bras, free underwear, and just a little care package in that bag as well. I did a demonstration on actually how to examine your breast, and a number of even the older ladies said no one has ever shown us how to do that. We made certain that we coincided with when the BreastScreen bus was in town. On the first day, the bus was full. On the second day, the bus was full. The communities we've gone into, such as Walker and Uralla and a number of other places, the breast screening rates have improved across the New England Northwest by 4%. As women, we're the caretakers of the family. We look after everybody else and we put ourselves last. The take-home message from there was that you're important and you are worth it. The feedback from that event was absolutely amazing. When they were leaving, they were pulling up and thanking us for the day, saying what a great team of ladies we are, and what wonderful organisation HealthWISE must be to work for, because we all get on like we're firm friends, which we do, because HealthWISE is our family.
Really, the primary healthcare nurses provide a bit of a gap in that service delivery. So we know that things like transport and cost and time constraints and all those sorts of things can put a lot of barriers in place for people accessing healthcare. So if you live in a smaller community like Malali or Manila, actually coming over to Tamworth for a day can be really expensive. You might have to find daycare, you have to have time off work, you might need petrol for your car, all those sorts of things. So the primary healthcare nurses, by going out to those local communities and providing the service there, is such a benefit and really helps to remove those barriers.
Lots of times people don't understand that when we go into these small rural communities, we might be the first person they've seen. For probably one gentleman told us 10 years since he'd seen a doctor, another young fellow told us it was 6 years since he'd been to a doctor, and we explained that the doctor needs to see him well to know what he looks like when he's sick.
I can think of instances where we've actually recommended people go to the hospital.
Yes.
Directly from our health check.
Yes. It's that important. We could refer them on to the hospitals, we refer them to their doctors.
We realise all our conversations are making a difference, And they're little interventions, but they can make a real difference to that individual and also their families, especially when we might have a chat about someone's mental health or their worries, and we can help direct them to some support. That can make such a difference to them and their family and their community, and that's important.
It's a flow-on effect. We totally understand the value of what we do, and we're very, very mindful that it's a privilege to be having that conversation with these clients. We don't know people's situation. We don't know the family's situation, and the cost of living has increased. So what's normal to us may not be normal to somebody else, and just treating every individual who comes to see us exactly the same.
Without judgment.
No, without judgment. You know, everybody's circumstances are totally different. So when we sit these people down, we do not know what sort of conversation or which direction it's going to go. But we are confident and caring in our dealings with every different client that comes along.
I think in the city it's easy to take things for granted. Access to support, access to healthy food, access to shops, access to doctors. We take these things for granted sometimes. Rural people don't take those things for granted. There's a lot of barriers to accessing care, and just a lot of the simple things that are everyday things for us. Things like fresh vegetables, clean water, transport. We're not confrontational. We just meet people where they're at. If they're at the sale yards, if they're at a community show, or wherever they are, we're just there in the background doing what we do, gently and quietly. And often we know the communities that don't have certain services. So I can think of occasions where we've suggested someone who can't get into their GP maybe go and see the chemist and keep an eye on their blood pressure at the chemist. If they can't get their women's health check done, maybe go and see the community nurse. Just finding other avenues for people to access the care they need. I can think of a school where the children didn't have access to water and the school was providing the water. We were just supporting that, making sure the school had water bottles, that the children had water bottles, and just adapting what we were doing to suit what was going on in that community at the time.
The programs that they do around oral health with the kids and things, the information that they provide to women, the health checks that they do at these smaller communities, I think not having those will leave a real gap in the community.
We've received several awards and accolades for our work to be recognised by Hunter New England Health. We're a finalist for our oral health program, getting out to 70 schools.
In 2019, we had 12 small schools that we visited, and now we visit 70. We visit those schools annually. The small little schools that might only have 3 students, they might have a lot more students. But going year after year, we realise that those messages stick. And yeah, I'm pretty proud of that. As someone said to me recently, imagine all the teeth you've saved. I think that's wonderful.
We've made inroads into those schools providing nutrition and oral hygiene, but also Bush Kids First Aid, teaching children about CPR, calling 000, bandaging a wound, you know, all those very, very important things.
A lot of the communities live quite a distance from support. Some of the students don't even know their address. They don't know how to phone an ambulance or emergency services. So we go through that process with them to teach them how to phone an ambulance, what's the nearest cross street, how to help someone in an emergency situation. We deliver sun safety messages. We deliver talks on personal hygiene, which got a little bit tricky through the drought. We talk about nutrition, physical exercise. Sometimes we go into these small communities with our partners and each deliver a different message.
I would imagine that 75% of the actual schoolwork that we did, if not even more, was based on the fact of the HealthWISE contacts. Basically, our programs in school and on sun safety would have been very minimal without the help from HealthWISE accessing those very vital connections in the school communities. The partnership that we've been able to establish with HealthWISE, Chris and Letecia in particular, has just really enabled Cancer Council to get into an area that we probably didn't previously have access to. The school-based education around sun safety was a smaller priority amongst the organisation. We did a lot of work behind the scenes, but to actually be out there in the schools and having that ability to talk to the students, pass on some really important messages for them as young, influential citizens was just a great way for us to get recognition for the work that we could do and really enabled us to be in a lot of communities that we wouldn't have been able to be in otherwise. It's some of those rural areas that are even harder to access, where some of the mainstream methods of communication aren't as easy, and the smaller communities really appreciate the effort and the time taken to go in and speak to them. One of the highlights of my role over the last 10 years with Cancer Council has been that ability to be in the schools talking to children. The opportunities that we have given and the way that I've been able to report back to the organisation on the benefits, it's just really changed and put a little bit more emphasis in our organisation around that whole school promotion. But a lot of that happened only with the experience of working with the HealthWISE team.
At times, HealthWISE has rural health students come to visit for placements. They might be dietetic students, they might be social work students, all kinds of disciplines. So we like to take them out to the rural communities to visit the small towns and schools and show them really what these small communities are about, some of the barriers they face. I took some dietetic students to a very small school. We went around the vegetable garden, through the chicken house, and did some cooking and nutrition talks with them, and the students just loved it and thought they might want to come back and work in the rural areas. So taking the rural students out to the small communities means they get an idea of the distances people are travelling, all the barriers that rural patients face, and then when these patients land in city hospitals, these clinicians then have a better idea of the barriers in these small communities, but also how wonderful they are.
So going to smaller communities is always hard to get into those communities, get access to them, or to have people come. So the events like Warialda Women's Night and the Warialda Community Men's Evening that we attended had really large crowds that we wouldn't have been able to organise ourselves. And so we can't thank HealthWISE enough for always inviting us along to those sorts of events where we have access to just sometimes hundreds of people, and that's been so important with our partnership with them and so valued.
There's been a lot of wonderful highlights. So I would say when we did the first two really huge events, we did an event in Gaia on the Friday night and we followed it up with an event in Warialda on the Saturday night. At the time we had funding for 100 ladies to attend these lovely events. We ended up with 250 ladies coming to both events. They were huge. Everyone had heard about it. We'd done similar smaller events before, but the ladies in those communities wanted to come along. We always have very good quality guest speakers, and so we really have been privileged to deal with the cream of the crop. The information we provide is up to date. It's relevant, focused on creating healthier communities, which is our vision. Those two nights were absolutely splendid. We commenced the men's nights in Warialda. The first night we had catered for 150 men. We got 3 RSVPs, and on the night we had over 160 men. That particular event we did for 5 years in a row. Our biggest number was 260 men attend. We covered all the problems that men have below the belt that they never talk about. We always have a draw card at the men's nights. We usually have a sports personality. Wendell Saylor come along one night. He was absolutely wonderful. We've done men's nights in small areas like Delungra. We've done Bundara. We've done Cropper Creek. We've done several small communities. We've even had the flu vaccinations done on the night. I think the Warialda night has to stand out to me. And the doctors in that small community at Warialda tell us that the uptake from these events in the following weeks, their appointments escalate by 1/3, which is a lot of people because the men are going off to have every check known to man. They're going to have their PSA done. They are making certain they've done their bowel screening. They're having their heart health check.
Over the years I've worked with them on some fantastic events. It's always a lot of fun. I always see huge benefits for the people that come along in being able to access health checks, in being able to be provided with information, and continually amazed and impressed by the number of people that they get to events. And that might be, you know, like I attended a recent International Women's Day and there were sort of 140 people there on a Monday, or it might be at a small community hall out the back of Tambar Springs and you've got sort of 20 or 30 people there. So they provide those wonderful opportunities for both small and rural communities to come along.
Some of the work that I'm most proud of is what we've done post bushfires and post the disasters. A lot of these small communities have suffered drought, bushfires, COVID, mouse plagues, and we've been able to stay in touch with them throughout all those disasters. I'm very proud of that.
We actually were contacted after the bushfires up in Tenterfield. We jumped in the car and we drove straight up there on the Friday to see that and be there at the front line firsthand when families were coming in and they had lost absolutely everything. Everything smelt of smoke, and all of our medications, our scripts, everything was in the home. And so we did health checks on that day. We did referrals off to the doctors. We rang doctors' surgeries to make certain they could get their scripts. There was people who'd lost their clothing. We rang the second-hand stores to see what was open. There was a gentleman who was homeless, and so just trying to organise a swag for him, organise clothes, organise food, and also organise water. You know, the same with after the Tinga fires. They didn't know where they were going to, what resources they could get, so we made certain we were there to assist with anything we possibly could. Had the same with Bonchore flood. The flood came up and came through the houses as quick as lightning, the ones that were on the river. Lots of people were then transported to the local hall, so we were out there with all the other service providers to make certain we could help out where we possibly could.
I think they're so well known, they've got such a great reputation. They have really strong ties with individuals and with individual communities.
Some really lovely connections we've got, and because we're one of the services that have been accepted into those communities, they'll contact us if they've got someone struggling, they've had a death out there, it's had a major impact. You know, what services can we offer? Can we come out and host an education session or an event that will inform the community and provide advice and referral pathways for them? Upper Horton is a small hamlet, a small community. There's probably only a handful of houses in Upper Horton, but the Upper Horton district is quite large. We've been and done a number of events down there. Over the time I've been going down there, we have noticed that there has been an increased number of young women who have developed breast cancer, bowel cancer, and a number of the other cancers. So we felt it was very, very timely to host an event down there. So knowing our communities, we know what's happening a lot of the times in different places. That's had a flow-on effect to affect the whole community. We are so lucky because with our management, we've actually been given the wings to fly. They have allowed us to widen our scope and be able to go into these communities and offer so much more. The Cotton Conference and AgQuip, absolutely amazing events to go to. It's very busy. We have a huge number go through. They are just such worthwhile events because we're actually going to where the farmers are. I think we could never ever know the full value of those events. They are absolutely amazing to attend. But having the partnerships like the Cancer Council there, we also work with the University of Newcastle. We're doing health checks, but we're also working with our future doctors, our medical students, and giving them just a taste of country people, their humour, but also, you know, an understanding of how different they view health to everybody else. They can come into us, they can have a skin check, they can have a health check, and then they can also have the hearing done. That's a farmer's 3-in-1 really. We have the best team in our HealthWISE people. We have our dietitians, we had our mental health clinician this year. That was absolutely excellent. HealthWISE is an amazing organisation. It's just like a big family. Wealth of experience and a wealth of knowledge within our team.
And I think at HealthWISE we're very lucky to have a very good Aboriginal health team.
We are.
We work very closely with our Aboriginal health team in all our communities.
It's a wonderful organisation to work for. We're well looked after, we're well cared for. We work with the best teams right across the board, whether it's our admin, our comms team, our strategic planners, our mental health team. Everybody has a role to play. Everybody is wonderful. If we need advice, if we need support, if we need team members to come to events that we're hosting, everybody is on board. It's just a wonderful program.
Yes, I can think of some events where we've had the entire office involved in the planning.
Yes.
Even down to admin helping us, pack bags and...
Yes.
Yeah, we're very lucky.
We never underestimate the value of the role we play. We're going into these small communities where no one else goes, and we've got wonderful partners in those communities. We've forged a lot of great relationships. It's just really important, the role that we've had the privilege to play.
From Tenterfield to Tinga, Deepwater to Delumbra, Weenala to Walker, Dara to Gravesend, Bindra to Barraba. Health checks, information days, winter warmers, evenings like this. I've been really fortunate to work with Chris and Letecia.
You opened the doors many times for us. We've had a lot of fun.
They've been wonderful, passionate individuals to have. I will certainly miss them as well as their communities missing them.